Packard, founder of Healthcare Voices, an independent group of healthcare advocates organizing adults with serious medical conditions for affordable comprehensive healthcare. Laura, thanks so much for coming on the show. Where should people start looking? Walk us through the process.
Well, no matter what state you're in, you should go to healthcare.gov to start shopping. If there is a state-specific marketplace in your state, it'll then route you to the right place. So start at healthcare.gov, and what you should have handy is your tax information, what you think you'll make for next year, because that, as you go through the process, will help determine if you're eligible for subsidies.
I know there are different tiers, Laura, of plans. We've got bronze, silver, gold. What is the differentiating factor between these tiers, and what do consumers need to know?
Well, theoretically, they are designed in order of how expensive a metal is, but setting aside things like rose gold and how much these metals actually cost, the idea is that as they get more expensive, you pay more in month for premiums, but your deductible is less. So if you know you're going to need a lot of healthcare next year, you may want to look at a gold or a platinum plan. If you are looking for the absolute cheapest plan per month for you right now, and you're not expecting high medical costs next year, you could go with something like the bronze.
Any tips for choosing the best plan and lower premiums? I mean, prices, we know, Laura, are up across the board. Americans feel it in every aspect of their lives. How can they best save on health care, even if prices, regardless, are going to rise?
Well, you should take a look at how much you spent on healthcare if you have that information, how much this year, so you can get a sense of what your costs might be next year. Do you have any expensive drugs that you need to take that you need to make sure your plan will cover those prescriptions? Or are there specialty doctors that you need to see? If you don't need any of those things, you could go for the cheapest lower monthly cost, which is the bronze. But if you did have any expensive medical bills, that might change your thinking. So go to healthcare.gov, go through your options, and see what you're eligible for, because it could be that a silver plan will actually be cheaper for you if you're eligible for the cost savings.
Mm-hmm. And what's new for 2023? I mean, what changes should people be aware of?
Well, it depends on your state, but there are insurers always coming and going. So in many places, you will have more options for next year than you had in the past. But also, if it's been a while since you've gone to healthcare.gov, you should go there now, because thanks to the American Rescue Plan and now the Inflation Reduction Plan, it's more easier, it's cheaper than ever to get these plans depending on your level of income, because it's capped at 8.5% of your income. So in the past, maybe you didn't qualify for help because you made a little bit too much money. So check it out. You'll enter what you think your income will be for next year and see what is available to you.
Mm-hmm. Now, are these plans, Laura, eligible for HSA, a health savings account, for instance?
It depends, and it really depends on your state, on your county, what's available for you. Where I live in Denver, I had a choice of plans that had HSA capabilities. So really, you'll need to look at your options and make sure that it says whether it is HSA compatible or not.
Mm-hmm. All right, I think we got to leave it there. Laura Packard, founder of Healthcare Voices. Laura, thank you.